Welcome to Stroke Forward. My name is Marcia Moran. For the next 40 minutes or so, we are going to talk about things that stroke survivors or any brain injury survivor deals with. If you look at me today, you probably don't see a person who had a stroke, but I feel it. My body functions differently. Do I think I will get back to 100%? Yes, because to think differently is to admit defeat. We will talk to all sorts of people who have been there, from survivors to caretakers to doctors, nurses, therapists, friends, and family who have seen us at our weakest. They have cheered us with their victories, no matter how large or how small. How did we get here? That's what this show is going to tell you. Erin Pasky is a registered dietitian nutritionist and NASM certified personal trainer. Her specialty is guiding people to feel confident in their eating and exercise habits to regain overall health and wellness. Erin specifically helps those with weight and fitness goals, as well as cardiac and digestive concerns. Erin is certified in weight management, food sensitivity management, and has several years of experience in disease prevention and management at Inova Fairfax Hospital. Erin was inspired to start Eat It Erin after working with patients in clinical settings who frequently sought out partnership with a reliable, experienced dietitian outside of the hospital. Erin's mission is to help individuals live their healthiest, most confident lives. Erin provides virtual, one-on-one, individual nutrition, fitness, and wellness coaching. Erin will be your teammate as you create and maintain a balanced lifestyle you can be proud of. So I'm delighted to introduce Erin Pasky to the show. How are you doing, Erin?
I'm doing very well. How are you?
I'm just fine. Thank you very much. So why is good nutrition important for people who've had brain injuries?
So, eating well after a brain injury is key to recovery and long-term outcomes. Choosing healthy foods can help control blood pressure, cholesterol, body weight, which can help reduce a person's risk for having another stroke and may help them with the demands of that brain injury, the therapy that occurs in daily activities. And there are some complications after a brain injury that can make choosing healthy foods very difficult. But our body and our brain still need adequate nutrition to function the way that we want it to. And our baseline needs, pre or post brain injury, need to be met. And in fact, for some, the brain and the body's protein and calorie needs increase and sometimes double the normal resting requirements after that brain injury. So what happens is our body is kind of in an anabolic state. What that means is that it's in a repair, construction, healing state. So when you think about it, food is fuel, right? So we need oftentimes more fuel or better fueling strategies to make sure that you're supporting your brain. So we need, balance and variety of nutrients, micro, macronutrients. And 1 in 3 stroke patients are likely to be malnourished. So a lot of times we think about eating less, but when it comes to nutrition and eating, but that's actually not as appropriate for most people.
Okay. Interesting. So you mentioned micronutrients and micronutrients. What are they?
Yes, great question. A question that I cover a lot. So micronutrients, as opposed to macronutrients, are comprised of nutrients that are needed in a smaller amount. So that's why we think micro versus macro. But macronutrients are protein, carbohydrates, and fat. Those are the 3 macronutrients. Okay. Technically, and these 3 macronutrients provide our body energy, which we typically think of as calories. Mm-hmm. Technically, alcohol it also gives our body calories, but we don't consider it a macronutrient because it's not really giving our body anything that it requires. It's more of, has more detrimental qualities versus giving our body the energy that it actually needs. But the micronutrients are comprised of vitamins and minerals, which are required in those small quantities to ensure normal metabolism, growth, and well-being overall. So I excuse me, I tend to help people with micronutrient testing because that is something that a lot of times at your normal doctor's visit, you might get, a 24-hour serum test or extracellular micronutrient testing. But to really understand how your body is absorbing these micronutrients, it's beneficial to get an intracellular micronutrient test to understand, on, a deeper level, how your body specifically, and personalizing your diet to make sure that you're getting in these nutrients and they're actually going where they need to go, and making sure that your blood levels are up to par.
Interesting. So I had a blood test, actually 2 blood tests done after my stroke. And the doctor said that I was allergic or sensitive to 50. And yes, I am saying 50 things.
Mm.
So tell me what the difference is between an allergy, intolerance, and a food sensitivity.
Yeah. So it's a very common misconception between the three. So, food intolerances refer mostly to the inability to process or digest a certain food. So, oftentimes we'll have some type of indigestion symptoms, such as, bloating, gas, constipation, diarrhea, or just a stomach pain. It'll be very localized to the gut. So, for example, a lactose intolerance is what we think about most often, which is an intolerance to dairy. And the best way to control that intolerance is to avoid that food. However, there are certain also supplements that can be beneficial, certain enzymes that can help you, or probiotics, or there's certain times where we can kind of fill in the gaps with certain supplementation that can actually help to heal the gut a little bit more. But usually that food intolerance or that food needs to just be avoided. Whereas a food allergy is a more severe, more acute problem that occurs when someone has an allergic reaction. Is usually it occurs very quickly. It's within kind of a 24-hour period, and it's a response by the body's immune system against something that's seemingly harmless. So we don't only think about food sensitive or food allergies. We also think about allergies to pollen and other, seemingly harmless occurrences in nature that our immune system is responding strongly to. And this is the most dangerous because it can have that anaphylactic shock response and it can cause death, whereas food intolerances and food sensitivities aren't as life-threatening. But with an allergy, oftentimes it will be both localized to the gut as well as skin. You might have some type of rash or skin response that occurs very quickly. Sometimes with allergies, it may cause a headache or a migraine. So it's a little bit more wide range than what a food intolerance would be, right? One thing I will mention within the umbrella of allergies, celiac disease is technically not an allergy. We typically hear, oh, you're allergic to gluten and you have that celiac disease, when in reality, that's actually an autoimmune disease. It's different.
Interesting.
So yeah, both cases, if you are allergic to gluten or different wheat components, then that's different than celiac disease. However, the outcome is the same. We want to avoid gluten, right?
Right. That's interesting. I didn't know that about celiac disease.
Yeah, and so food sensitivities are a little bit more complicated. So after eating certain foods, a large part of the population experiences symptoms that are not related to food intolerances or food allergies or celiac disease. These are referred to as food sensitivities, and it's more of a delayed response. So it doesn't always happen within the first 24 hours of eating a certain food. It may happen up to 72 hours after eating a certain food, and that a certain symptom occurs. And it's not just localized to the gut, it's a wide range of symptoms that may occur. They're not life-threatening, but they're very life disruptive, right? So, it might be joint pain, fatigue, rashes, headaches, brain fog, things that just are I've had some people who come to me that are just so disrupted by just brain fog alone. And we discuss and we get to the bottom of their food sensitivities together. But yeah, gluten is probably the best known trigger for food sensitivities. And there's some controversy about exactly what happens in the body of someone with a food sensitivity. But we do know that it does create an immune reaction that generates a multitude of different types of symptoms.
Interesting. So are people often unaware that they're sensitive to foods?
Yes, that is a very common thing. With food allergies, because it's more immediate, right? People are able to identify, okay, I know that I'm allergic to shellfish, or I'm allergic. Shellfish, peanuts, and tree nuts tend to be the foods that adults are most likely allergic to. Sesame's on the rise, but those are some common allergies that people will be able to tell, and you would go to an allergist for something like that. However, with food sensitivities, because of the fact that we just there's not as much data, and it's so hard to pinpoint. We're still learning a lot more, but I'm sure, although there's, I think there's about 20 to 30% of the US population that have food intolerances, 10% of adults in the US have allergies, but we don't know a specific percentage of those that have food sensitivities, right? But my guess would be that it would be much more.
Right. Okay.
Yeah. And when you think about that percentage, it's millions, right?
Yeah, it's scary because you don't really understand what you're allergic to until I found out because I went to a doctor, but I wouldn't believe that I was allergic to or sensitive to 50 things.
So true.
And what he told me is that it was causing me to have leaky gut. So what is leaky gut and what do you do about it?
Yes. So leaky gut, basically what is happening in the body, it occurs when there is damage to the lining of our intestinal tract, making it more permeable to substances that should not cross that delicate lining. So normally only nutrients from fully digested foods, such as vitamins and minerals, and fats and amino acids from proteins and simple sugars, those are the only things that should cross that intestinal barrier. But what happens is the gut becomes leaky, or those undigested particles of foods and bacteria and toxins can kind of enter our circulation and go to places where they don't belong, causing different, symptoms. So yeah, many people, experience leaky gut and don't realize it. It can be silent for a while before symptoms occur. Our bodies are good at adapting and trying to fight it off, and then it doesn't, and then symptoms tend to occur. But yeah, leaky gut does occur, whether from celiac disease or something known as SIBO, small intestinal bacterial overgrowth, is another thing that can kind of breach that intestinal tract. But then the most common food sensitivities are the main cause and symptoms associated with leaky gut. And as I mentioned, gluten being the number one that is can cause that, because it's not just leaky gut, or it is leaky gut. It's not just the sensitivity. It's gluten itself can often cause a rise in something called zonulin, which is a chemical, and that directly can open up those tight junctions and lead to leaky gut. So that is something that some people will find they need to kind of take breaks from gluten and re-add it back in.
So does the sensitivity to food then cause inflammation?
Yes, it can.
Okay.
So that's kind of when we are experiencing those symptoms, that's a response to inflammation. Okay. So, and one thing I will say is that food reactions, especially sensitivities, can improve over time with kind of that, steering clear from those foods for a certain amount of time, and everybody's different with that. Our immune systems, our gut microbiome, our bodies are continually changing. So what may not sit well with our bodies today, in the future, we may feel fine with those foods. So it's really important at a certain point to liberalize the diet. And it could be good to consider reintroducing foods that you may have been sensitive to, and see kind of which foods you're able to tolerate at a certain point.
What happens if I like going to McDonald's or Burger King or Taco Bell or anything like that?
I think
bad for me.
Well, so I think what's worse is what we do on a normal basis. If we're not consuming a balanced diet, getting more of those nourishing foods in on a regular basis, that is more detrimental than the occasional fast food trip. Now, if somebody's going daily and that's kind of taking the place of a burger made at home, or something that's has a little bit more potential to add some more high quality foods, that's a different story. And of course, everybody's different and needs that personalization of how can we potentially switch that up, to where some people might benefit from switching up the place that they go out for kind of fast casual eating. If they think of Burger King as a place where they really only like one thing, it's like, I would never tell somebody, oh, just go to Burger King and just get a salad instead, because that's not what you really want, right? So I think really there is a place for any food, but it's important to make sure that what we do most often is, going to make the biggest difference, and that consistency will kind of make sure that our bodies are in a healthy place.
Okay. So I can sneak out for a burger every now and then.
Yes, definitely.
Okay.
Yes, your body will not break down overnight.
Good. So I've been curious, is there a way for food and your medications to interact?
Yes. So it depends on the medication,
Okay.
but there are blood thinners, statins, blood pressure medications are common to interact with grapefruit and grapefruit juice, and Seville oranges and tangelos. There's a couple of like those deeper, darker orange fruits, not regular oranges, not lime or lemon, not citrus in that way, but grapefruit, Seville oranges, which I think are a darker, deeper orange, and tangelos will have that a specific component in them that interacts and actually interferes with the absorption of that medication. So that's one. Another one that's very common is warfarin or Coumadin, and that's an anticoagulant. So that is a specific medication that can interfere. So it causes, or it helps with blood clotting, and so does vitamin K. So a lot of dark green leafy vegetables, or even blueberries, have that specific, that higher amount of vitamin K that can interact with warfarin or Coumadin. And that is something that it's important to work with your doctor on that, because what I've found in my experience is when you work with your doctor, they can monitor your levels. And if you're eating the same amount of vitamin K each day from these foods that are richer sources, then you may be able to be just fine with your with the levels in your body for the risk for blood clotting. Other specific foods that are common, alcohol can interfere. And we hear don't take medications with alcohol, but also even consumed hours apart, there can be impact on mixing them. So it just depends on the person to person, but we don't want to abuse alcohol for that reason, among the many reasons, right?
Right.
And then dairy is another one. So dairy is a very rich source of calcium, which can interfere with some antibiotics and some iron supplements. So iron and calcium are competing in the body. So you don't want to take calcium supplements with iron supplements. That's just another thing to think about. But you also shouldn't you shouldn't consume dairy with calcium channel blockers, which is a blood pressure lowering medication, which is common with a lot of brain injuries. So so that's just one to be aware of, not taking your meds at the same time that you have dairy.
So are you saying that I can have dairy like 2 or 3 hours after I take my medicines then?
Yes.
Okay.
Yeah. So yeah, as long as you don't have a negative response to dairy, then you can definitely, going back to that intolerance conversation, but yes, you can definitely still consume dairy safely at the outside of those time windows that you're still working to break down that medication.
Okay.
And I would say the last one that I would say is that doesn't always come up, but it can, because oftentimes someone who it's a very common when someone's treating depression, They're called MAOIs, monoamine oxidase inhibitors. And what that drug can interfere with is the breakdown of tyramine. And tyramine is an amino acid found in a lot of different foods. So high levels of tyramine in the bloodstream can also lead to an increase in blood pressure. So that's why with those specific MAOIs, we don't want to also be eating high tyramine foods at the same time. So chocolate, processed meats, aged or matured cheese, and soy products are high in tyramine. And there are others. So, if someone is taking that, just, doing a Google search and understanding what are some high tyramine foods.
It sounds like if you have a test and you find out you're allergic or sensitive to a number of foods, you're going to have to change your diet. What do you recommend for the person who's starting out with that? Like, I don't know what to buy.
Yeah, so it does depend on it. If someone is doing a food sensitivity test, the test should ideally show a list of many, many foods that you can eat. And so working with a dietitian to utilize those foods versus saying, just avoid the foods that you can't have. And that is just so much easier said than done. So, yeah. But usually, for example, with the MRT test, so that is a mediator release test, and some dietitians offer that. It includes 175 foods that are tested, and maybe 15 to 20, maybe, someone might be sensitive to. When you're sensitive to 50, I guarantee you there's varying intensities for how severe that response in your body is. Yeah. So I wouldn't be avoiding 50 foods for life. It's just another thing to keep in mind. But just recognizing that, creating a list of all the foods that you can eat and categorizing that, right? Because we do want the protein, we do want carbs, we do want fats. And I know you asked me a little bit more about the macros, which I didn't necessarily touch as much on that as the micronutrients. But we need all three for optimal nutrition, for your muscles, for both protein and carbs, for your hormones with fats, and just the regulation of thermogenesis in the body, making sure that you're warm enough. There's so many different reasons we need fats, we need carbs, we need proteins. And we need to ideally have the balance between the three at each meal. So if you're sensitive to a lot of foods, sometimes it's challenging. So we want to focus on the foods that we can have is my first thing to recommend. And again, creating lists and recognizing these are foods that are rich in proteins, these are foods that are rich in carbs, these are foods that are rich in fats. And then also these are foods that will give me those micronutrients, those vitamins and minerals. So those colorful foods, whether it be fruits or vegetables, to get more of. And to make sure that you're able to have 3 balanced meals a day, and kind of considering that we're human and we want to have varying textures and different types of foods at different times. So, making sure that you have, snacks on hand, foods that are crunchy, foods that are creamy. If we can't have dairy, what's that nut or specific grain that can be kind of blended up, or how can we make these foods that are creamy? How can we make certain foods that give us a texture and mouthfeel that we look forward to? So there's a lot of things that we don't think about, and that can kind of lead to us feeling like, oh my gosh, forget it. Let me just throw in the towel and run to Burger King, right? So right. I think it's it's important to work with a dietitian so that way you can come up with strategies and have support, and kind of come up with a plan that is personalized to you.
Interesting. You've talked a lot about eating. Do you talk about exercise when you're working with clients?
Oh, definitely. Definitely.
You've got somebody who has had brain damage, and they're mobile, so they can walk around. What kind of exercises do you think would work better for them?
So I think that it's important, regardless of the person, to have a variety between strengthening, lengthening, and cardio. And there are varying ranges of how people can kind of work on these 3 categories, right? So it's not saying that you have to go and out and run to get your cardio. What would work for you? Would it be walking? Could it be biking? Could it be dancing? Is it an arm bike because, your brain's not able to kind of send the right communication to your legs? There's ways to get your heart rate up that can kind of check off the box for cardio, right? with strengthening, the same thing applies. You don't have to think just strength training when it comes to heavy lifting, right? It can be many different applications of strength training. It can be weight-bearing yoga or Pilates, anything that really can include, whether it be a dumbbell, a medicine ball, resistance bands. There's all kinds of ways that you can get some weight-bearing activity in, but that is crucial for any specific person. But yes, with brain injuries, it is a very important piece because your body is working just slightly differently than it used to, and your brain may not be sending the signals that it used to. So being able to work your muscles back to a point where they're listening, in a way that you have kind of that brain-body connection, and that your muscles are, growing and maintaining really the strength that they've always had. And that also will benefit your bones. It will benefit so many different functions. Your mood will improve. So I also think with lengthening, so we don't want to just think about strengthening and cardio. We also want to make sure that you're stretching, right? So some people will, be huge avid stretchers. Other people are huge avid cardio individuals, and others are really big in strengthening. And so it's just figuring out where are the gaps within your exercise program, so that way you can slowly build in some different types of movements that your body may not be doing as much as it would be beneficial to do.
So if there were one thing that you wanted to tell the audience, what would it be?
Yeah, so specifically in regards to nutrition, I would say that healthy eating shouldn't make you focus on the foods you can't have and how your life may be worse off without certain foods. The shift in the focus should really be on what are the foods that we can have and how will that improve my life.
Right.
So I think that's a big thing. And in regards to nutrition and exercise and lifestyle and sleep and hydration and all the different facets of what can improve our health, keep it simple, right? So decide on one or two habits that are I kind of consider the low-hanging fruit, right? And start with kind of SMART goals to make progress towards those. So SMART, kind of being an acronym to kind of make sure that we're setting ourselves up for success appropriately. So that way we are able to make strides in areas that will just improve our overall health and life.
Okay. So how can people reach you?
So I'm best reached by email, nutrition@eatwitherin.com. You can also, there's a message feature on my website, eatwitherin.com, so you can reach out to me that way. And yeah, I'm also on social media, but not a huge presence. I kind of not a huge fan for my own balance and happiness, but I think email is probably the best for me.
Okay. Well, thank you for taking the time to speak with me today, Erin. It's been a blast.
Thank you, Marsha. Yeah, this has been fun. Thank you for inviting me.
Thank you for listening to Stroke Forward Podcast. If you enjoyed the podcast, please like it on Facebook, LinkedIn, or anywhere else you heard it. If you want a copy of Just Say Yes to Life, please order it from Amazon.com. The proceeds go to Stroke Awareness Oregon, an amazing nonprofit that educates about stroke causes, prevention, and treatment options. The book, Stroke Forward, is also available on Amazon.com.